together to lobby at the African Union level that they can have a say and negotiate strongly with the big boys in the market that do the procurements. Over to you.
Thank you for the questions. I'll take some of the questions and then I'll leave the vaccine questions to my colleague, Nazim. I'll take the question on WHO regulatory standards that I mentioned earlier in my, when I was giving my speech. What WHO has done is come out with a framework of standardizing the level of regulatory systems strengths among national medicines regulatory authorities, NMRA. They've got maturity level 2, maturity level 3, and then maturity level 4. Maturity level 4 is considered as being the standard of stringent regulatory authority level, which is SRA. So most regulatory authorities in Africa are being inspected on an annual basis to determine their level of compliance or their strength of, and I think a lot of them are working very hard to achieve the highest level, which is maturity level 4. I think if I'm not mistaken, I think there are only 2 at the moment that have reached maturity level 4. But that's not where it ends at the end of the day. We have got countries like South Africa that are members of what is called PICS, which is the same regulatory grouping. You've got Australia, New Zealand, and other countries. Australia is considered as SRA, but South Africa is not considered as SRA. So it means that if a manufacturer in South Africa has to undergo WHO PQ for him to be considered by Global Fund to supply, and by UNICEF to supply pandemic drugs into Africa. And we see there's a bit of politics involved in that. And as FAPMA, we've been fighting very hard to say if a regulatory authority in Africa has reached maturity level 4, then it means all companies in that country should qualify for SRA, and they should not be subjected to WHO PQ for them to supply medicines to the Global Fund. And that's what we've been fighting for. And we said, okay, let's put aside WHO PQ, let's look at, we have the standard maturity level 3 to 2 to 4. Because for a regulatory system to be able to be considered to reach maturity level 4, it means manufacturers in that country, they've got strong regulatory systems that ensures that manufacturers in that country comply with the GMP, and they make medicines that are quality assured, that meet the stringent, which is as good as what you get in Europe and so forth. And we had a very good experience with Global Fund. And then we agreed on a roadmap, what we call a roadmap, with the Secretariat at Global Fund, which was a stepwise approach, which was eventually going to lead that would have attained a certain level of quality standards to be able to supply medicines in Africa. And so they said, okay, the agreement was that we start with non-pandemic medicines, essential medicines for common infection. And Global Fund was supposed to pay a tender of about 20 to 25 million US dollars. That is going to be to say, APMA, we are approach our members and do a screening process of identifying manufacturers that it was a desktop survey. Conducted a university in Tanzania to do the desktop screening survey, and we went to our members, and each member was supposed to paid $1,500 and submitted their proposals, and the screenings were done. I think there were 20 members, that companies that applied, and the university did its screening, and 15 to 16 companies were shortlisted. And we had a conference in Addis, which was then with Global Fund and so forth. But before the implementation of that, the person who was heading that desk was dismissed. And then Global Fund went through a massive restructuring. Even up to now, we're still trying to find out whom we can talk to at Global Fund. And, but the important thing is that African governments are members of the Global Fund. So they sit on the policy, on the board of Global Fund. So that's why it's important then we direct our advocacy to our governments, so that when they go to Global Fund, then they mandate Global Fund and say, oh, we want you to come out with a program that ensures that you procure from African manufacturers. And then they come, and then we then get involved. Because then it was at a level that we could not even ourselves be able to. I think there was a question from the Investment Authority of Uganda, which I'll give you an example of what we've done in Zimbabwe, which I think could be an example as well of how we've managed to integrate into the development strategy. There's a National Development Strategy 1 for Zimbabwe, which is the NDS 1, which runs from 2022 to 2026. It's a 5-year program. We were involved in the formulation. Pharmaceutical industry was then identified as a priority sector. Then there was a strategy. We've got a pharmaceutical manufacturing strategy, which was launched, which we were assisted by UNIDO to come up with, and then it was adopted by government, and it was launched by government, and as part of their blueprint for the development of the pharmaceutical industry. And then we've got performance indicators in the National Development Strategy 1, which we give quarterly reports through the Minister of Industry to the Minister of Finance and so forth, which what we call performance indicators. And part of the indicators is the level, the percentage of locally produced medicines, exports, and also import substitution and so forth. So we report on a quarterly basis. And we work with the Minister of Industry, we work with the Medicines Control Authority of Zimbabwe, we work with the Zimbabwe Statistical Agency, and also with the Revenue Authority. And we compile statistics, which we then feed these are quarterly reports that go to cabinet, and then they are discussed and so forth. So that there we see an integration between what we are doing as a manufacturers association and also within the, I think it's a framework that is, I think, very much, and it gives us the platform to be able to engage at the highest level in making them aware of what needs to be done to create that environment. And we see a lot of policy disharmony, and some of those policies, we get them addressed because they become impediments to the implementation of National Development Strategy 1 in the pharmaceutical manufacturing plan and so forth.
There were some really, really important, interesting questions on vaccines. But can I just ask Solomon, I was under the impression that we have a session in the afternoon on vaccines. Can we leave it till then? Because there is a lot to discuss on, and I would love to start a dialogue. So let's park those, okay, until after lunch. I think you asked us, do we know who our competitors are? It's a very good question. It is very simple. 70–80% of the products are coming in from India and China. Those are our competitors. problem is, and certainly when I was both FIAPM and Uganda Pharmaceutical Manufacturers head, we had many discussions with the government to say, look, please be aware that if I was an Indian company selling to Uganda, the Indian government will give me very nice incentives. So it's not a level playing field. So how can I compete when that Indian competitor is getting a sales discount? So their actual cost of drugs is about 20% below mine, just purely on government subsidies. And you know, our governments know this. Of course they know this. But unless they can make some policies to create a level playing field, we're always going to struggle, frankly. We're always going to struggle. So I think that's why I was very keen to say, look, we need to, and maybe the fault lies with us as associations. Maybe we just haven't been aggressive enough to say to governments, look, we've got to pay together. We've got to work together here. So I think that's a very good question, but we are certainly aware of who our competitors are. And you know, I mean, I was at a WHO meeting where there was a massive concern that the whole HIV/AIDS antiretroviral market is controlled by 3 companies. They're all vertically integrated, they make their APIs, and they make the final products. And there was a discussion going on, my God, if these 3 countries decide to either raise these, so you know, so there is a lot of discussions going on, and I think we'll come back on vaccines. We'll come back if you don't mind later on. Was there anything else from me? I think, yeah, I think talk about. Have we presented our discussions with the government? Personally, certainly in Uganda, we did quite a bit of it. We had once as an association about 10 years ago. And I have to say, as a Ugandan, we have done very well to support local manufacturing. You know, you heard about this 12.5%, although when I was wearing my East African hat, my colleagues were saying, this is illegal. How can you allow Uganda to charge 12% to in the community law? It is illegal, but I said, you guys take it up at your level because I can't do anything about it. So yes, we have done. I mean, NMS very kindly put a tender out just for domestic companies. So those tenders just go to Ugandan companies. Excellent idea. One of the things that Bangladesh used to do. So there are improvements, but we have a long way to go. And on vaccines, maybe let's come back, huh? Would you like to add anything?
No, the issue of, there was a question there to say, do we have formulations or can we manufacture vaccines? I think I want to go along with Nazim to say, can you talk more on that? But just a 22nd class of microbiology 101.
Attention, everyone.
In the article, microbiology infections, bacteria are bad, they give us TBs and other killer diseases. But viruses are worse in the sense that they mutate so fast. And I heard that we might have a chance to go and see the here in Uganda. It's here in Uganda. We can do it. And we can develop vaccines that chase these viruses as they mutate. And we can decide, do we take the whole virus or attenuate it or take a piece of the virus? We know those things. We can develop it. Thank you.
Honorable panelists. Thank you, audience, and I think we can be excused from the stage. Solomon, I hand back to you for direction.
Thank you very much. A round of applause to the panelists. Thank you very much. All these views have been captured and certainly are going to be incorporated into a report. This whole thing called pharmaceuticals, I'm really, really, really loving it. Every single day I learn a thing or two. As I told you, I'll be a pharmacist by association by the time I leave this place. Yes, thank you very much. Clap for yourselves for also listening in and being an engaging audience. Thank you. Joan, where are you? Joan, come and tell us where the lunch is going to be served. We will be back in about 40 minutes. Please come. Where is the lunch going to be served? Okay, great. So you just step out straight up. There's lunch there. I'll see you in 40 minutes. That should be at 2. Yeah, 10 minutes past 2, I think. Should be good. Yeah, you can leave everything here. Everything is sorted. Yeah, we're going to be locking the room so you don't have to move with your laptops or your bags. Everything is going to be safe. All right, thank you very much. Let's go and have lunch, and we'll be right back for another panel on vaccine manufacturing. Karibu.